Today's health question is, what is Crohn's disease?
And fortunately, we have Dr. Ryan Bendl. He's a colon and rectal surgeon with the Western Connecticut Medical Group. Welcome.
Thank you.
So what's Crohn's disease?
So Crohn's disease is one of the inflammatory bowel diseases that can affect anywhere from really the mouth to the anus. So there are a variety of different presentations and different ways that it can affect people, from abdominal pain and bleeding to infection type symptoms. And it's a condition typically controlled with medications, but unfortunately there's no real cure for it. Even the medication treatments, which actually are very good, is stuff that typically you have to maintain for a lifetime.
And this typically involves younger people, does it not?
It can, and actually it can involve patients from very young to very old. So we actually see two really curves. Again, one patients in their teens or 20s, and then again later in life. But it really can affect anyone at any age.
It can sometimes be a challenge to diagnose because affecting the whole GI tract, it can have many different kinds of symptoms.
Correct. Yeah. So a lot of times it's the disease is something we can diagnose colonoscopically, so with a colonoscopy. But again, yes, because of the nature of it, be it that it could affect anywhere in the GI tract, it can be sometimes difficult to diagnose.
And that goes along with when I was growing up, one of the very famous gastroenterologists from Yale, Dr. Howard Spiro, used to make a point is that if you have a patient with recurring abdominal pain and you're having trouble making a diagnosis, think Crohn's. And it was, we always worried about that in the background, particularly I guess if someone has signs of other illness, weight loss or other things, but it can be a subtle disease.
Yeah, but you're right, it can be very subtle in terms of the diagnosis, but the ramifications of it going untreated can be, can cause scarring or narrowing of the intestines, kind of malabsorption, so your ability to absorb certain nutrients.
And now, as you said, some of the new medicines have been extraordinarily effective in controlling this disorder.
Which is the great news for it.
Which is really great news.
Great. Thank you so much.
You.
And if you have a health question for a doctor or would like to suggest a topic for a future show, we'd love to hear from you.
Send your question or comment to healthtalk@wchn.org.
Thank you so much for watching. We'll see you next time.
Bye-bye.